Welcome to this presentation on blood pressure and cardiovascular health. Today, we're diving into a critical health topic, blood pressure and its impact on cardiovascular health. Hypertension, often called the silent killer, affects millions worldwide. Understanding it can be life-saving. So let's explore everything from warning signs to cutting-edge treatments. Hypertension sneaks up quietly, often showing no symptoms until it's too late. It silently damages your heart, brain, and kidneys. But here's the good news. Knowledge is power. By learning how blood pressure works and how to manage it, you can take control of your health. Understanding blood pressure. What is blood pressure? Defining the basics. Blood pressure is the force of blood pushing against your artery walls. It's influenced by how strong your heart pumps and how narrow or wide your blood vessels are. Maintaining the right balance is crucial to staying healthy and avoiding serious complications. How does blood pressure work in the human body? Our heart is a powerful pump. When it contracts, it pushes blood through our arteries. This is systolic pressure. When it relaxes, the pressure drops. This is diastolic pressure. But it's not just the heart at work. Our blood vessels expand or contract to regulate flow. The kidneys and nervous system also play a role, adjusting pressure based on our body's needs. The silent killer. Why blood pressure matters. Hypertension doesn't just raise numbers on a monitor. It silently damages your body. It strains your heart, increasing the risk of heart attacks and strokes. It harms your kidneys, your eyes, even your brain. And because it often has no symptoms, people go years without knowing they have it. That's why monitoring your blood pressure is essential. It could save your life. Epidemiology of hypertension. Global and Indian. Epidemiology of hypertension. Hypertension is a global crisis. Over 1 billion people are affected, and the numbers keep rising. In developing countries, lifestyle changes, like unhealthy diets and sedentary habits, are fueling the epidemic. India is no exception, with 1 in 3 adults affected. This isn't just a statistic, it's a wake-up call for all of us. Shocking statistics. Blood pressure in India. The numbers are staggering. 1/3 of urban Indians have hypertension, and even in rural areas, 1 in 4 is affected. Over 200 million people in India battle high blood pressure, yet only 42% are aware of their condition. That means millions are living with a ticking time bomb, without even realizing it. Risk factors and high-risk groups. Who is most at risk for high blood pressure? Hypertension doesn't discriminate, but some people are at a higher risk than others. Age is a major factor. Our blood vessels stiffen over time, making older adults more vulnerable. Family history also plays a role, meaning genetics can put you at risk. But the biggest culprits? Unhealthy lifestyle choices, poor diet, lack of exercise, smoking, and stress. The good news? Many of these risk factors can be controlled with simple changes. Understanding blood pressure, measurement, scales. Ever wondered what those 2 numbers mean when your blood pressure is checked? The top number, systolic pressure, measures the force when your heart beats. The bottom number, diastolic pressure, shows the pressure when your heart is at rest. Together, they reveal whether your heart and blood vessels are working smoothly or if there's cause for concern, normal versus elevated versus. High blood pressure ranges. Knowing your numbers is the first step to staying healthy. A normal blood pressure reading is below 120/80. If it's slightly higher, you might be in the elevated range. This is a warning sign. Stage 1 hypertension starts at 130/80, and Stage 2 at 140/90. But if your readings ever reach 180/120 or higher, it's a hypertensive crisis. Seek medical help immediately. Top 10 warning signs of hypertension. Persistent headaches. Headaches happen for many reasons, but if they're frequent and intense, they could be a sign of high blood pressure. Hypertension can increase pressure in the brain, causing throbbing headaches, especially in the morning. If you're experiencing this, don't ignore it. Check your blood pressure and consult your doctor. Shortness of breath. Feeling out of breath with little effort. High blood pressure can strain your heart and lungs, making even simple activities exhausting. Fluid buildup in the lungs can make breathing difficult, a warning sign that your heart is working too hard. If this happens often, get checked. It could be your body signaling trouble. Chest pain and discomfort. Chest pain is never something to brush off. Hypertension can narrow your arteries, reducing blood flow to the heart. This can cause angina, tightness, or pressure in the chest. If you experience this, especially with exertion, take it seriously. It could be an early sign of heart disease. Irregular heartbeat. Does your heart ever feel like it's skipping beats? High blood pressure can lead to arrhythmia, an abnormal heart rhythm. If you frequently experience palpitations, fluttering, or a racing heart, it's time to talk to your doctor. Your heart could be struggling to keep up. Vision problems. Blurred vision. Trouble focusing? Hypertension can damage the tiny blood vessels in your eyes, leading to hypertensive retinopathy. Left unchecked, it can cause permanent vision loss. If your eyesight is changing unexpectedly, don't wait. Get your blood pressure checked and see an eye doctor. Fatigue and weakness. Feeling exhausted all the time? When your blood pressure is too high, your organs, especially your brain and muscles, may not get enough oxygen. This can leave you feeling drained and weak. If fatigue is interfering with your daily life, it might be more than just stress. Your heart could be signaling trouble. Nosebleeds. Occasional nosebleeds are common, but frequent or heavy nosebleeds could be a sign of uncontrolled hypertension. High blood pressure can weaken the blood vessels in your nose, making them more prone to bursting. If this keeps happening, it's worth checking your blood pressure. Dizziness. Frequent dizziness or lightheadedness can be linked to hypertension, especially if blood flow to the brain is affected. This can lead to balance issues and an increased risk of falls. If you often feel dizzy when standing up or during daily activities, consult a doctor. It might be a warning sign. Anxiety and nervousness. Hypertension doesn't just affect your body. It can impact your mind too. Chronic high blood pressure can contribute to anxiety, making you feel restless, nervous, or even panicked. If you're feeling unusually on edge, it could be time to check your blood pressure. Swelling in extremities. Ever notice swelling in your legs, ankles, or hands? High blood pressure can make it harder for your body to regulate fluid, leading to swelling known as edema. If your shoes feel tighter or your rings leave marks, your blood pressure might be a factor. Risk factors of hypertension. Genetic predisposition. Does hypertension run in your family? If so, you may have a higher risk of developing it. Genetics play a significant role, but remember, your lifestyle choices still matter. Knowing your family history can help you take preventive steps early. Lifestyle choices. The way we live has a direct impact on our blood pressure. Diets high in sodium and saturated fats can spike levels. A sedentary lifestyle weakens the heart. Smoking and alcohol? They only make things worse. The solution? A heart-healthy diet, regular exercise, and quitting harmful habits. Age and gender. As we age, our risk of hypertension increases. Blood vessels lose flexibility, making it harder for blood to flow smoothly. Men are more likely to develop high blood pressure before 65, while women's risk rises after menopause. This makes regular monitoring crucial at every stage of life. Dietary habits. Too much salt can be a major trigger for high blood pressure. Processed foods, restaurant meals, and even snacks often contain hidden sodium. But it's not just salt. Diets high in unhealthy fats and low in essential nutrients can also contribute to hypertension. Choosing fresh, whole foods can make a big difference. Stress and mental health. Stress isn't just in your head. It affects your entire body, including your blood pressure. Chronic stress can keep your levels elevated, increasing your risk of heart disease. Mental health conditions like anxiety and depression can also contribute. Finding ways to relax, whether through meditation, exercise, or hobbies, is essential for your heart's well-being. Natural methods for controlling high blood pressure. Diet modifications. Diet, nutrient-rich foods. The food you eat has a powerful impact on your blood pressure. The diet, rich in fruits, vegetables, whole grains, and lean proteins has been scientifically proven to lower hypertension. Potassium-rich foods like bananas, spinach, and sweet potatoes help balance sodium levels, reducing strain on your heart. Small dietary changes can lead to big improvements in your health. Regular exercise. Movement is medicine. Regular physical activity strengthens your heart, making it pump blood more efficiently with less pressure on your arteries. Aim for at least 150 minutes of moderate exercise per week. Walking, swimming, or cycling are all great options. Even small activities like taking the stairs or stretching can make a difference. Stress management techniques. Stress is a silent trigger for high blood pressure. When we're constantly anxious, our body stays in fight or flight mode, keeping blood pressure elevated. Mindfulness, meditation, and deep breathing exercises can help calm the nervous system. Taking time to relax isn't a luxury. It's a necessity for your heart health. Weight management. Carrying excess weight puts extra pressure on your heart and blood vessels, increasing the risk of hypertension. The good news: even losing just 5 to 10% of your body weight can significantly lower your blood pressure. A balanced diet and regular exercise are the best ways to achieve and maintain a healthy weight. Reducing sodium intake. Too much salt in your diet can send your blood pressure soaring. Many processed and restaurant foods contain hidden sodium. Start reading labels, opt for fresh foods, and season meals with herbs and spices instead of salt. Your taste buds will adjust, and your heart will thank you. Limiting alcohol consumption. Drinking too much alcohol can raise your blood pressure over time. Moderation is key. Stick to 1 drink per day for women and 2 for men. If you're at risk for hypertension, cutting back on alcohol can make a noticeable difference in your numbers and overall well-being. Quitting smoking. Every cigarette you smoke temporarily raises your blood pressure. Over time, smoking damages your arteries, making hypertension even worse. The best time to quit is now. Seek support, use nicotine replacement therapies if needed, and remind yourself, quitting is one of the best things you can do for your heart. Herbal supplements, garlic, hibiscus. Nature offers some powerful tools for blood pressure control. Garlic has been shown to relax blood vessels, while hibiscus tea contains antioxidants that may lower hypertension. But remember, while these can help, they are not substitutes for prescribed medications. Always check with your doctor before adding supplements to your routine. Meditation and yoga. Yoga isn't just about flexibility. It's about balance inside and out. Studies show that yoga and meditation can reduce stress, improve circulation, and lower blood pressure naturally. Even a few minutes of deep breathing or a calming stretch can make a big difference. Proper sleep hygiene. Poor sleep can lead to higher blood pressure and increased stress levels. Aim for 7 to 9 hours of quality sleep each night. Keep your bedroom dark, quiet, and cool, and try to maintain a consistent sleep schedule. Restful sleep is essential for a healthy heart. Medical treatment approaches. Lifestyle modifications. Before reaching for medication, doctors often recommend lifestyle changes, like a healthier diet, regular exercise, and stress management. These modifications can sometimes bring blood pressure back to normal without the need for drugs. But for many, medication is still necessary for full control. Medication. When lifestyle changes aren't enough, medication can help regulate blood pressure and prevent complications. There are different types of blood pressure medications, each working in unique ways. The key is to find the right one for you, under your doctor's supervision. Pharmaceutical interventions. Diuretics, ACE inhibitors, calcium channel blockers, beta blockers. Doctors prescribe different medications based on your specific needs. Diuretics help eliminate excess sodium, reducing fluid buildup. ACE inhibitors relax blood vessels, lowering pressure. Beta blockers slow the heart rate, reducing strain. Each medication has benefits and potential side effects, so working closely with your doctor is essential. When to consult a healthcare professional. If your blood pressure is consistently high or you experience symptoms like chest pain, dizziness, or shortness of breath, don't ignore them. Seek medical attention promptly. Early intervention can prevent serious complications like heart attacks and strokes. Diagnostic tests for blood pressure. Doctors may recommend tests to understand what's driving your hypertension. Ambulatory monitoring records your blood pressure over 24 hours, while EKGs check for heart strain. Other tests, like kidney function analysis, can identify underlying issues contributing to high blood pressure. Understanding medication options. Taking blood pressure medication as prescribed is crucial. Many people stop their meds once they feel better, but hypertension is often a lifelong condition. Regular checkups help ensure your medication is effective and adjusted as needed for optimal health. Common myths about hypertension. Myth 1. High blood pressure is always symptomatic. Many believe that if they feel fine, their blood pressure must be normal. But hypertension is often silent, showing no symptoms until it's dangerously high. That's why regular checkups are essential. Waiting for symptoms could be too late. Myth 2. Young people can't have hypertension. Think hypertension only affects older adults? Think again. Poor diet, stress, obesity, and lack of exercise are driving high blood pressure in younger generations. That's why early awareness and healthy habits are crucial. Prevention starts now. Myth 3. Medication causes side effects. While all medications have potential side effects, most people tolerate blood pressure meds well, and the risks of uncontrolled hypertension, heart attacks, strokes, kidney failure, far outweigh the minor side effects of medication. If you experience issues, talk to your doctor. There are many options available. Myth 4. Salt is the only dietary concern. Salt plays a role in high blood pressure, but it's not the only factor. Diets high in saturated fats, sugar, and processed foods also contribute. A heart-healthy diet isn't just about cutting salt. It's about balance, variety, and nutrient-rich choices. Myth 5. High blood pressure is inevitable with age. While blood pressure tends to rise with age, it's not inevitable. A healthy lifestyle, balanced nutrition, exercise, stress management can keep hypertension at bay. Aging doesn't have to mean high blood pressure. Prevention is possible at any stage of life. Prevention strategies. Regular health checkups. Prevention starts with awareness. Regular checkups help catch high blood pressure before it causes damage. A simple blood pressure test takes minutes, but can save your life. Make it a habit to check your numbers at least once a year, or more often if you're at risk. Home monitoring techniques. Want to take control of your blood pressure? Home monitoring is a game changer. A reliable home blood pressure monitor lets you track changes over time. Take readings at the same time each day. Stay consistent, and share your results with your doctor for better management. Personalized health plans. One size doesn't fit all when it comes to health. Work with your doctor to develop a plan that fits your lifestyle, risk factors, and goals. Whether it's adjusting your diet, adding exercise, or managing stress, a tailored approach makes a world of difference. Nutrition counseling. A healthy diet is your first line of defense against hypertension. Consulting a registered dietitian can help you make the right food choices, from reducing sodium to increasing heart-friendly nutrients. Small changes in your plate can lead to big improvements in your blood pressure. Holistic wellness approach. Your health isn't just about numbers, it's about balance. A holistic approach considers the mind-body connection. Stress management, good sleep, and mental well-being are just as important as diet and exercise. A balanced lifestyle leads to a healthier heart. Technology and blood pressure. Management, telehealth. Technology is making healthcare more accessible than ever. With telehealth, you can consult doctors from the comfort of your home, get medication adjustments, and track your blood pressure remotely. Convenient, efficient, and life-saving. Remote monitoring. Imagine your doctor keeping an eye on your blood pressure even when you're not in the clinic. Remote monitoring devices send real-time data to your healthcare provider, ensuring timely interventions and better control over your health. Mobile apps for blood pressure tracking. Smartphones can do more than just connect us. They can help us stay healthy. Blood pressure tracking apps record your readings, provide trends, and even send reminders. Find a reliable app and make tracking your numbers part of your daily routine. Wearable devices and health monitoring. From smartwatches to blood pressure cuffs, wearable technology is revolutionizing health monitoring. These devices track your heart rate, activity levels, and even blood pressure, helping you stay proactive about your health. Knowledge is power. Use it to your advantage. Mental health and blood pressure. Connection. Stress isn't just a mental burden. It takes a toll on your heart, too. Chronic stress can keep your blood pressure elevated, increasing the risk of heart disease. Prioritizing mental well-being through relaxation techniques, therapy, and self-care can have a powerful impact on your health. Psychological impact of hypertension. Living with high blood pressure can be stressful in itself. Many people experience anxiety, fear, or even depression. It's important to acknowledge these emotions and seek support. Whether it's through counseling, meditation, or connecting with others, managing the emotional side of hypertension is just as crucial as controlling the numbers. MCQ section. Test your blood pressure knowledge. What is considered a normal blood pressure reading? Correct. A normal blood pressure reading is less than 120 by 80 mmHg. Higher readings may indicate hypertension risk, so regular monitoring is essential. Which of the following is a primary risk factor for hypertension? That's right. Genetics can increase your risk of high blood pressure. However, lifestyle choices still play a huge role in managing and preventing it. Which techniques can help manage hypertension? Absolutely. A heart-healthy diet, stress management, and regular exercise all contribute to better blood pressure control. Small changes make a big impact. Which medication helps kidneys eliminate excess sodium? Correct. Diuretics, also known as water pills, help remove excess sodium and fluid from the body, lowering blood pressure. Final recommendations and takeaways. Hypertension is manageable with the right lifestyle choices and medical care. Regular checkups, healthy eating, exercise, stress control, and medication adherence can protect your heart and overall health. Stay informed, stay proactive, and take charge of your well-being. Thank you for joining this session on blood pressure and cardiovascular health. Remember, knowledge is power. Share this information with loved ones and make health a priority. Stay healthy, stay safe.